let's talk about our acid-base systems in our body. Okay. So why are we even talking about acid-base balance? Why is it important?
We have a normal pH.
Why do you have to have a normal pH?
For homeostasis.
For homeostasis, but what does that mean?
Your body produces acids and bases, but you need them to be kind of level. Yeah.
Or else what?
You die.
Why?
Or else we have problem.
Like
we
what?
Have unbalance.
Renal tubulopathy.
Renal tubulopathies. Okay, do you think your organs like sitting in acid?
No.
No, right? Do you think your organs like sitting in a base solution? Base solutions aren't good for you either, right? So we can't be acidic, we can't be too basic, we do have to be in the middle because our organs have to have a certain pH in order to sit and survive, okay? And what is that blood pH?
7.35, 7.
All right, 7.35 to 7.45. What's a normal blood pH?
7.35 to 7.45.
Very good. Okay. So there are two systems in your body that manage acid-base balance. Yes? Okay. We've got the kidneys and you got the lungs. Besties, right? If one of them's having a hard time, the other one will be there for you, right? Okay. Turn over your papers because y'all don't need to read to me, okay? Because if I ask y'all questions and you just read to me, I don't know if you know it or you don't know it, right? Okay. So y'all can jot down notes on Post-its or on your own notebook paper or whatever if you think there's things you don't know, all right? I give the handouts. I want y'all to have the handouts so you can study something later, but I want y'all to get out of them as much as possible while we're in here so that you can engage your brain instead of reading back to me, right? Because I feel like sometimes when you're reading the handouts, you've read them so many times, they sound familiar, but then when you get on an exam, you don't know how to apply it because you've just read it too many times. Okay. All right. So let's start with the lungs. What is the acid in your lungs?
Carbon dioxide.
CO2. Carbon dioxide is your acid. Carbon dioxide is your acid. Okay. That means that oxygen is your base. So those are going to go on a seesaw, right? You understand what I'm saying?
Yes.
Okay. So inside your alveoli, you have what's called like a water wheel. Okay. You don't know what a water wheel is? Do you know what I'm talking about? Okay, what's a water wheel?
Just keep going.
Yeah, y'all seen them, right? Okay, so like when water comes in, it turns the wheel. You have a water wheel in every single one of your alveoli, okay? And oxygen and air have to come in to start turning it, and then what comes out? Pushes the oxygen in, pushes out the CO2. And that's how you acid-base balance in your lungs. So you have to be breathing in enough air to push the water wheel to move and push out your carbon dioxide, which is your acid. Okay. So if patients are not breathing in very deep, like after surgery, or maybe they're on opioids and they're doing very shallow breathing, are we moving the water wheel? Okay. So we're not taking in very much oxygen. So that means you can't get rid of your carbon dioxide. So they will be hypoxic. Hypo means low, oxygen. Okay. So they will be hypoxic. And if their oxygen is low, that means their carbon dioxide is going to be high because they're going to go on a seesaw, right? What is high carbon dioxide called?
Hypercapnia.
Very good. Hypercapnia. What's high CO2 called? Hypercapnia. So it is very common for a patient to be hypoxic and hypercapnic at the same time because they're not bringing in enough oxygen and air, which means I can't turn the water wheel, so I can't get rid of my CO2. So what acid base imbalance would I be in if that were the case?
Respiratory. You said low hypercapnia.
Mhm.
Too much.
Too much CO2, not enough oxygen. So you would be in what acid base imbalance?
Too much CO2.
Alkalosis.
What are you retaining?
Retaining CO2 acid.
Oh, acid.
So you're going to be in respiratory acidosis, right? Do you understand what I'm saying? Okay. So how could I help them to get rid of that acid?
Inject them with bicarb.
Well, that was really exciting and aggressive. Think of something very simple.
Kuzma breathing.
That's something they're naturally going to go into, and that's not going to help me. What do they need to get rid of?
Carbon dioxide.
Okay. So how do you guys get rid of carbon dioxide?
We breathe.
Yeah.
You breathe what?
We breathe.
Oxygen.
Well, you breathe in oxygen, you breathe.
Carbon dioxide.
So what are you going to teach them to do?
Deep breathing.
This is called pursed-lipped breathing.
Oh,
In for 2, out for 4, and that can correct that imbalance. Do you see? That's why when patients are post-surgery, all right, so they've just had surgery, they've just had anesthesia, right? So how are they feeling?
tired, groggy.
Yeah. So how they breathe after anesthesia?
Not very well. Very low.
Weak.
Are we turning? Okay, so they can't bring in
Oxygen.
and they can't get rid of carbon dioxide. So what acid-base imbalance will they be in after surgery? Respiratory acidosis. So what I teach that patient to do, wait, think about it. They're breathing like this. What do you have patients do after surgery? How do you teach them to breathe?
Is it that like tube thing?
Mm-hmm. Have you all been in clinical?
No, ma'am.
Not yet. Okay. The incentive spirometer, which is at the bedside, right? Because the incentive spirometer, it's like, do you know what I'm talking about?
That thing with the ball in it?
Yes.
Okay.
So that thing with the ball in it, no, they put their mouth on it. And a lot of students think you blow in it. You don't blow in it. You take a deep breath. Why do I want them to take big, deep breaths? What am I trying to do?
Move the water.
Turn the water wheel. Because if they take a deep breath in, the oxygen and the air is coming in. It's going to push out the carbon dioxide. Do you understand? All right. So let's try another one. Let's say your patient's on massive opioids. What do opioids do to your respiratory system? Depress it. Okay. So what's a normal respiratory rate for a person on opioids?
Normal.
11.
11 or 12. I agree. 11 or 12 is probably about right. Okay. If they go less than 8, intubate. Okay. If they go less than 10, usually we'll go ahead and give them the antidote, which is naloxone, right? Okay. But let's say I walk into my patient's room and I have given them like morphine 8 milligrams. They're flying high, right? So I look over at them. They're like this, right? And they're like, what acid-base imbalance are they going to be in?
Isn't it also respiratory acid?
It's respiratory acidosis because are they taking deep breaths?
No.
Very shallow breaths. So returning the water wheel.
Mm-mm.
So is oxygen coming in?
Mm-mm.
Is CO2 going out?
No.
Mm-mm. So what I'm going to have that patient do? Yes, I'm going to have them do the incentive spirometer too. Pursed lift is blowing out the CO2. The reason the person on opioids has respiratory acidosis because they're taking shallow breaths. So I want them to take bigger, deep breaths.
Oh, okay.
If you have a patient that, let's say, has COPD, all right, what's COPD? Chronic obstructive pulmonary disease, right? And that's because they smoked a whole bunch. They got a bunch of inflammation in the lungs, right? Okay. So their alveoli becomes very crummy. They can't gas exchange very well. Okay. And their lungs become very hard and they don't move. They're like concrete lungs. Okay. So when the patient is trying to take a deep breath in, they can't because it's concrete lung, right? So will it help for that patient to take a deep breath? No. So what could you do for that patient?
But you want to get rid of like all
You want to get rid of their CO2.
Stuff, right? Oh, sorry.
How do you get rid of their CO2 when they can't take a deep breath in?
You do the lift.
That's when you do the pursed lip breathing. So you see, you can't memorize these like, oh, respiratory acidosis, pursed lip breathing. You have to understand what's going on with your patient and fix that problem. So if it's like opioids, post-surgery, they've had anesthesia, they've been sedated, those kind of patients will go into respiratory acidosis because they're not taking deep breaths. So what do I want them to do? Take deep breaths. And a patient with like COPD or emphysema or something where they have an obstruction and they can't take deep breaths, that doesn't help, then I just have to help them blow off the CO2. Do you understand what I'm saying? Okay. All right. Now let's talk about the kidneys. Okay. Kidneys are your metabolic system. What's the acid of the kidneys?
No, that's base. Sorry. Is it hydrogen?
Hydrogen. What's the base?
Hydrogen.
Excuse me.
Bicarb.
Hello, everyone. Let's start over. The kidneys are your metabolic system. Okay. What is the acid of the kidneys? Hydrogen. What is the base? Bicarb, which is HCO₃. Right? So the acid of your kidneys is hydrogen. The base is bicarb, which is HCO₃.
Yes.
Okay. That's why urine is acidic. One of the jobs of your kidneys is to get rid of hydrogen, get rid of acid. So what happens if your kidneys are broken? Let's say you have an acute kidney injury or renal failure. What acid-base imbalance will you go into?
Acidosis?
What kind?
Metabolic.
Metabolic acidosis. Now, your kidneys can't compensate like the respiratory system can. If they're broken, they're broken. So they're going to ask their bestie,
The lungs.
help me out. So how are you going to help your lungs get rid of CO2? And this is something their body will naturally go into. You don't have to even force them to do it. That's right. And that is called Kussmaul's breathing. Their body will naturally go into Kussmaul's, which is deep, rapid breathing. Like if you see a patient that has DKA, what's DKA? Diabetic ketoacidosis. That's a kidney problem. Diabetes has kidney problems, right? Their kidneys are broken. Can their kidneys fix themselves? Nope. So they got to ask their bestie,
The lungs.
the lungs, help me out. So when you go into that room, that patient's going to be breathing You're not going to have to tell them to do it. Their body is naturally compensating. Do you understand? So one of the signs of DKA is Kussmaul's breathing. Do you understand? Okay, so when you're looking at these test questions, you have to figure out what's wrong with my patient. And what I've seen people do is they focus more on the numbers instead of the patient situation that they're given. You can figure out an acid-base imbalance just by the patient situation. I've given y'all several and you've been able to figure it out. Sure, you can back it up with the numbers, right? But you know if a patient has COPD, you already know they're going to be in respiratory acidosis, right? You know if a patient's on massive opioids, respiratory acidosis, all right? What about if a patient's having a panic attack? All right, they're having an anxiety attack. How does that patient breathe? What acid-base imbalance will they go into? Think about it before you say anything.
Respiratory alkalosis.
Why would they go into respiratory alkalosis?
Because they are breathing out.
They're already getting all of it.
They're blowing out all of their CO2, which is acid. So the acid is outside, so they're left alkalotic. How do you fix a panic attack, a respiratory alkalosis?
Brown bag.
You have them breathe into a paper bag because they are going to breathe out their
Carbon dioxide.
and they're going to breathe it back in, correcting the alkalosis. Y'all have heard of doing that before, right? Now you know why. Do you understand? I can't tell within your face if you understand or you don't. I'm learning y'all's faces. I know hers. I'm not sure about yours yet because you look constantly panicked. Will you tell me if you don't understand something? Because your face looks like this all the time. So I don't know. You'll tell me?
Yes, ma'am.
Okay. All right. Do you understand how to play with these numbers and what to do for your patient? Depending on what's going on with your patient, you have to figure out how to fix it. Is that easy enough or not easy enough?
Yeah.
I don't know. Can you tell?
I can't tell him. No, I can't.
I don't know. What do I do? Do I move on or do we need to do it again?
Yeah, you can just move on.
Are you sure?
Yeah.
Okay, I'll learn your face better as we go along. All right, so let's now add our numbers to it. Okay, so y'all can turn these over just for now. Okay. All right, so you have got to know your lab numbers, otherwise you won't understand your ABGs. Yeah?
Yes.
Okay. All right, so you already know the blood pH should be
7.35.
7.35 to 7.45. Drop down the 3.5 and 4.5 from the 7 point, because everybody knows the blood pH. I don't know why, but it's just something everybody knows. If you drop down the 35 and 45, that's your PaCO₂. That's your CO2 level. Okay? Then the only one you really have to know is HCO₃, which is your bicarb, and that's 22 to 26. Yeah? Most of the time, they're not going to give you a PaO2 because that's way too easy if they give you a PaO2. Okay? Because that's your oxygen. So if I tell you your patient's, the only number I give you is your patient's PaO2 is 65. What do you automatically know? It's a respiratory problem because they don't have any oxygen. So you're already halfway through knowing respiratory acidosis or respiratory alkalosis. And chances are, if their oxygen is that low, are they turning the water wheel?
No.
Okay. So if they're not bringing in their base and they're not getting rid of their CO2, they're going to be in respiratory acidosis. You can get the acid-base imbalance just off the oxygen. You see what I'm saying? Mm-hmm. So most of the time they won't give it to you because it makes it too easy. So most of the time, all they'll give you is pH, PaCO₂, and HCO₃. Y'all see what I mean? Because if you look at an ABG that they give you and it says PaO2 of 90, it's not a respiratory problem. They're breathing just great. PaO2 of 90, they're oxygenating fine. It's a metabolic problem. Easy enough? So I'm going to do it without the oxygen, okay? Because most of the time, like I said, they won't give you that. If they do, great. Then it's going to make it really easy for you. Okay. So there are 3 steps to the ABGs, right? So you only have 2 blanks to fill out. So if you look at the bottom right here, we already did this, so this will review for him. But there are 2 blanks at the bottom. Respiratory or metabolic, acidosis or alkalosis. That's all you have to solve, right? So step number 1, use the pH to determine acidosis or alkalosis. Okay, so let's say the pH is 7.31. What are they in? Acidosis. So we're already halfway through, right? Step number 2, you're going to draw arrows to the HCO₃ and the PaCO₂, as well as you can do the pH too. So next to the pH, you're going to draw an arrow down because it's low. Draw an arrow down next to it because it's low. You see the example on the bottom right?
But PaCO₂ right here is 58. Is it high?
Yes, but do the pH first. So you see the pH is 7.31. That one's low, right? So you're going to put a down arrow next to it. Yes? Okay. PaCO₂ is 58. So we were told by Quinn that is high. Yes? Okay, so you're going to put an arrow up. HCO₃ of 24, high, low, or normal? Normal. So you can just put like a little line there, just like a little minus or something. All right, so that's step number 2 done. Now we're going to go to step number 3. We're going to use Rome. Respiratory is opposite. Metabolic is the same, meaning or equal. So depending on which way your arrows are going, that's whether you can decide whether it's respiratory or metabolic. Okay. So in this case, your pH on the example, your pH is low. Okay. Your PaCO₂ is high. Those are going in opposite directions. So it is respiratory. So this is respiratory acidosis, and you're done. Is that easy enough?
But in the in the review,
Mhm.
it is just halfway, because the first half is to find out is it respiratory or metabolic acidosis or alkaline.
Mhm.
The second part is the compensation.
Yes, we'll do that.
Yeah.
Yes, we will do that. So do y'all understand the basics of how to do like a normal ABG? Do y'all want another one to practice? Yeah?
Yeah.
Okay, let's see. Ba-dum-bum. Get over here real quick. Don't look at this. I'll stress you out. Okay.
So if the pH is high, would that be alkalosis?
Where?
No, I'm asking like, is the pH?
Oh, yes.
Okay.
I was like, I didn't write it. Where is it?
Oh no.
But I understand what you're saying now. Okay. Oops.
And if it's high, you have less hydrogen. And if it's low,
Well, it depends. You don't know. Because you don't know if it's metabolic or respiratory.
Oh. You're
Yeah,
right.
yeah.
You're right.
All right. Don't write it down until because I might want to play with some of the numbers really quick. All right, don't say anything, just do this one, okay? Go through your steps if you need to, or if you don't, that's fine too. You done?
Yes, ma'am.
Courtney?
I think so.
All right, what y'all got?
Metabolic alkaline.
Yeah, me too.
Because of
Okay.
the HCO₃.
It's normal.
It's normal though.
Right.
Yeah, so why
So-
is it what would it
Okay, start with step number 1. What is step number 1?
pH?
Okay, so what do you do with the pH?
It's too high, so it'd be alkalosis.
All right, so we're already halfway there.
Yes.
Alkalosis. Now you're in a step. What's step number 2?
If you look at pH.
Draw your arrows. Okay, so the pH is at high or low?
It's high.
The PaCO₂ is at high or low?
High. Yeah, it's high.
HCO₃ is at high, low, or normal?
Normal.
Okay, now you're going to use Rome. Respiratory, the arrows go in opposite directions. Metabolic, they go in equal directions. So both of them are going up. That's equal.
What? Oh, I see. Equals metabolic. And if they're
Yeah.
opposite, it's
Respiratory is opposite. If they're going in opposite directions, it's respiratory. If they're going in equal directions, they're both going in the same direction, then it's metabolic. Where are we losing you, sis?
See, last semester I didn't do Rome. I just looked at it,
Oh.
and the one that was off was the answer.
Oh no.
Well, no wonder I didn't do it in another
So that's why that one didn't work out. Now do you understand how to use it?
Yes, I do.
Okay, does everybody understand that this is metabolic alkalosis and why it is?
Yes, ma'am.
Okay. All right, let's do one more. And then we'll start talking about compensation, okay?
Yes, ma'am.
It doesn't matter what order you do it in, right?
No,
It
it doesn't matter.
depends
You're
on,
just
like, where the
going you're
arrows
just
are
going
at.
by the arrows,
Okay.
okay?
I don't know what I've been thinking on the example.
She's just like, and now I know my whole life was a lie. Okay. Mm. Okay, you'll do this one. Y'all got it?
Yes,
All right, what do we got?
Respiratory acidosis.
Good job, everyone. Okay, so these are basic ABGs. Are y'all with me?
Yes, ma'am.
All right. So now we will move on to compensation.